Hello, Christy. How are you?
I'm okay.
All right. Well, my name's Andre. I'm the student nurse practitioner at Youngstown State University. And what brings you into the office today?
Well, I'm really not doing well, to be honest. I've had a sore throat, runny nose, and today I've been having difficult breathing and coughing and been so tired. And I'm usually pretty healthy, so yeah, I thought I better get checked out.
Okay. And when did you notice that these symptoms were happening?
About a week ago.
Okay. And how would you describe some of the symptoms? Are you having you stated you're having a sore throat. I mean, does it hurt when you swallow? Do you have a decreased appetite?
Yeah, I feel like it's getting a little bit better. I haven't lost my appetite, thankfully, but I've had a cough for, I'd say, a good couple of days.
Okay.
And it's gotten a lot worse.
All right. And then how often do you have your cough? How would you describe it? Is it like dry or hacky?
Very frequent and dry. I haven't been coughing up anything, so
Okay.
I'm sure, I guess that's good. But it does have like drainage. I think it's making my throat irritated and sore.
Okay. All right. And then what color would you say the nasal drainage is? And, would you say you have a lot of drainage all the time, or does it come and go intermittent?
Yeah, I mean, I don't really know for sure. I think it's like I blew my nose a little bit. I mean, it's yellowish, greenish.
Okay.
Yeah.
All right. And all right. Well, thank you for sharing that information. That kind of gives me an idea of what's
Okay.
going on here. Is there anything that makes these symptoms worse or better?
The only thing I can think of is with wintertime coming, the dry air, that really hasn't helped at all. I've been using just some cough drops and drinking a lot of hot tea. Seems to help a little bit.
Okay. And any other symptoms that you noticed? Have you had a fever at all?
Yeah, I have. I've had a little bit of a fever, low grade. My ears are clogged and having discolored, like I said, nasal drainage.
Okay. And have you been having any issues with your hearing, or do you feel like that you don't hear as well as you normally do?
No, I mean, I think my hearing's all right. It's mostly just the congestion and my sinuses and my ears feeling that clogged up.
Clogged feeling?
Yeah,
Okay.
just a feeling of a little bit of, yeah, I don't know. I mean, I can hear still,
Right.
but
It's just kind of like that
yeah,
sinuses.
and it kind of comes and goes, like that popping sound or something.
Okay.
I don't know. I don't know.
Well, now, I mean, have you taken anything at home to help with this, like any medications or remedies?
Yeah, I have. I've been taking the Mucinex.
Okay.
And again, just some lozenges, cough drops, and been getting a lot of rest.
Okay.
I'm glad that I've been able to, because I'm off for school of school break, and I can get some sleep without having to study so much. So I'm hoping to get better real soon with that. But
Okay. And what are you in school for?
I'm going to get a culinary degree.
Okay.
Yeah.
All right. And then what school you go to?
Tri-C.
Okay. So local. That's good.
Right. Yeah.
All right. Well, good. So you're almost done, so that's good. And taking that break and getting some rest, I think that would be beneficial.
Right.
Now, have you had these symptoms before? Has there anything that helped in the past?
A little. I think just when I get stressed, so I've had a lot going on, and I try to manage the stress. Go, hang out with friends and get plenty of sleep. I do eat fairly healthy, and I do make a effort to exercise regularly.
Okay, and how often do you do that?
I'd say 5 times a week. I mean, I kind of skip weekends, but
yeah. And what exercises do you do?
Running. I'd like to hike and run, and I do a little bit of weightlifting.
Okay, so that's beneficial. That's good. It appears you do try to take good care of your health from the remedies and stuff that you've been using.
I do the best I can, I guess.
Yeah. So just moving on, do you take any current medications that you've been prescribed?
No, just birth control. I don't really take anything else.
Okay. And then do you have any allergies?
No, not to any medications that I know of, but just seasonal allergies.
Okay. All right. And then do you know the last time you visited your OBGYN?
Yeah, I I did. I had a routine PAP on the beginning of November of 2023.
Okay, good. And then no problems with that you noticed?
No,
Okay. And then any surgical history?
no.
Okay. So I do see from your chart that it looks like your mother has a history of asthma. Your father has high blood pressure. Your brother also has seasonal allergies. It looks like your sister didn't really have any medical issues, but you know,
Right.
sometimes respiratory things can be genetic and be passed down.
Oh, okay.
So that's something to look into. So what I'm going to do right now is just like an overall assessment. I'm just going to listen to your heart and lungs.
Okay.
And then after that, I'll do more of like a focused assessment based on the symptoms you're having, okay?
All right.
All right, so what I'm going to do is right now, your respiratory rate, you know, I've been looking at it while you're here.
Okay.
It's regular, it's even, it is a little fast at 22, but probably from the sinuses and everything, it's kind of tough breathing.
It is.
So what I'm going to do, slightly elevated around 22. I do want to just check for your chest if it's expanding symmetrically. If you could just turn a little bit for me.
Okay, sure.
What I'm going to do is just place my hands down here at the 10th ribs here. And what I'm going to have you do is just take a deep breath in your mouth. All right, good, and out. And then one more time. All right, good. All right, you can face back this way now. So that's good. The chest is, you know, it rises symmetrically. It was even on both sides. No use of accessory muscles noted. I can tell without even using my stethoscope to listen to you, you do have some an audible wheezing sound. That just can generally indicates like a narrowing or partially blocked airway.
Okay.
All right, but you know, we'll talk a little bit about that, you know, further going on.
Okay.
What I'm going to do right now is I'm just going to listen to your lung sounds real quick. I'm just going to listen to the front here. If you could take a deep breath in. All right, and out. Good. In and out. Good. Good. Yes, I do hear that expiratory wheeze that you have. Good. All right. All right, and then I'm just going to listen to the sides here. Deep breath in. Good. For the lateral sides. Good. And then the next side. Good. And then one more. Good. And then if you could just turn this way a little bit, I'm going to listen to the back here real quick. All right. So deep breath in. Good. Good. All right. So the posterior has 8 lung locations I listened to, and the anterior does have 10. Good. I'm still hearing the expiratory wheeze as I'm listening throughout. I'm just listening to these 8 and then listening to the lateral sides. Good. All right, good. All right, I'll have you face back towards me. All right, so next what I'm going to do is I'm just going to be using the diaphragm of my stethoscope. I'm going to listen to your heart sounds. So first I'm going to listen to the aortic, which is the second intercostal space, right sternal border. Good. Next is going to be the pulmonic valve, which is the second intercostal space, left sternal border. After that is Erb's point, which is the third intercostal space, left sternal border. Tricuspid point is the fourth intercostal space, left sternal border. And then listening to the mitral valve, which is the fifth intercostal space, left midclavicular line. All right, good. All right, so I did hear S1 and S2. Those are normal heart sounds. There was no S3 or S4 noted, and no murmurs noted either. So your lung sounds, of course, have the expiratory wheeze, but your heart sounds did sound good.
Okay.
So now what I'm going to do is just more of a more focused assessment based on the symptoms that you're having. I'm just going to check your eyes right now. All right. So just look straight ahead. I'm just going to use this. All right. All right, so what I'm going to do, all right, good. And then this side. All right, good. All right. So there was no fasciculations, tremors, flakiness, redness, ptosis, or swelling noted with your eyes.
Okay.
The conjunctiva is pink, moist, and translucent, free from erythema. No foreign bodies noted, no discharge noted, no tergigium noted. The lacrimal gland is normal, and no edema is noted either. The sclera is white and visible above where the iris, where the eyelids are wide open. The iris color is brown, and I do want to check your pupil size real quick. All right, so it does look like your pupil sizes are 2 millimeters bilaterally. Corneal clarity was assessed as normal, and lens clarity was also normal. And what I'm going to do next is I'm just going to check your ears. I know you were saying you were having some, feels like it was kind of clogged, so I just want to take a good look at that.
Okay.
So what I'm going to do is I'm going to pull the auricle up and back,
Okay.
and just holding with the handle up, I'm just going to look inside here. All right, good. Does look a little red, looks a little tender, probably from the sinus drainage and everything. I am going to look on the other side here, pulling the auricle back and up. All right, looking in here. All right, good. All right, so, the auricles, of course, are aligned. They're symmetrical. Of course, there's no lesions noted. Any tenderness with palpation here? A little bit.
Yeah,
Okay.
Yeah.
Yeah, so no lesions noted, no tenderness, other than just the little bit that you had just then. They did look a little red, but, mostly pink for the most part. No deformities. It does look like your ears are pierced. No cerumen noted, no drainage, discharge, foreign bodies, lesions, cracks, or redness. Tympanic membrane is purely gray with no edema or redness bilaterally, and it's intact with bony landmarks and the light reflex visualized bilaterally. And then I didn't see any evidence of fluid retraction, air, or bubbles noted in your ears.
Okay.
I am going to check your nose real quick. If you could just look straight ahead at me. All right. All right, good. All right, so it does look a little red, just probably from like coughing and sneezing and just the drainage that you've been having.
Right.
And I'm just gonna feel for any tenderness here. Any with your nose? A little bit.
Yeah.
Okay. So your nose is normal. Of course, it's midline. It's symmetrical. The color is good for patient's ethnicity. The septum is midline and bilateral. The nasal mucosa, just a little red, just like with the drainage and everything,
Yeah.
with coughing and sneezing. Mild swelling of the turbinates. Again, no discharge at this time noted. I do know, in the past you've been having a lot of it. No perforations. The mucosa is pink and moist. The turbinates are intact. No lesions noted. No bone or cartilage displacement noted, and the nares are patent. So next what I'm going to do is I'm just going to palpate your sinuses, your frontal and maxillary. I'm going to do that first. Do you feel Okay.
Yeah,
Yeah,
that's
that
really
does-
sore.
Okay. Yeah, I mean, that's an expected finding for what's going on.
Okay.
I'm also just going to palpate the rest of your lymph nodes. If you could just face me a little bit more. All right, good. So what I'm going to do, this is your pre-auricle and then post-auricular. And then also you have your occipital nodes here, just using about 2 to 3 hands in like a circular motion, feeling for those. Sternocleidomastoid mastoid.
That's a little tender.
Okay. And then you have your submandibular, your submental, your anterior deep, cervical neck chain, the posterior cervical neck chain, and then of course supraventricular, supraclavicular. All right. So these feel okay. I did feel some tenderness around here and with your throat, kind of to be expected with everything that's going on with you right now. What I'm going to do then is I'm just going to look in your throat real quick just to kind of see that. You said you were having a sore throat, so just open your mouth wide for me. All right, good. Say ah. All right, very good. All right. So it does look like there's 28 teeth counted from what I could see. They're in good condition without any evidence of occlusion, caries, loose or missing teeth, and then no surface abnormalities noted or no dental appliances noted. Um, your lips are pink, moist, and symmetrical. No evidence of edema, chapping, or cracked lips noted. Um, Buccal and oral mucosa are pink and moist and symmetrical, and no lesions, cuts, scrapes, or masses noted. I noticed your tongue is pink, it's moist, it's midline, no macerations. Your uvula is clean, moist, and pink. It rises evenly, and gag reflex is intact. Tonsils are present on both sides, +1. They don't seem to be inflamed or anything. I didn't notice anything abnormal with that, so not really indicative of like strep throat or anything.
Okay.
So I don't really feel like that would be an issue with this going on. The posterior wall of the pharynx is normal in color with no redness or inflammation noted. And I think this is more of like happening more in your sinuses rather than your throat. Of course, this could be like a drainage thing from that. All right. So just after my assessment, going through everything, just kind of want to try to like make a plan and figure out what's going on, okay?
Right.
So you've had these upper respiratory symptoms for about 1 week with worsening yellow-greenish nasal discharge, congestion, ear fullness, and you've developed a cough and you have audible expiratory wheezing, which can be common with an infection since it can cause airway inflammation and irritation. No fever. You did say you had one, but you haven't had one recently, correct?
Right.
Okay, so that's good. Your oxygen, when they got your vitals before you came in, was at 94%, which is good. And you're not requiring any supplemental oxygen, so that,
Okay.
There's no like blockage or occlusion that would,
Gotcha.
warrant that. Your history and family history of asthma and environmental allergies increase the likelihood of reactive airway issues. So right now, with everything that I've gathered, my diagnosis for you would just be acute bacterial rhinosinusitis. I don't expect you to have a viral infection due to your symptoms worsening rather than improving.
Oh, okay.
And allergic rhinitis or postnasal drip would generally have clear drainage. All right.
Yeah.
So what I would like to do is just prescribe amoxicillin. You're not allergic to that, are you?
No.
Not that you know of. Okay. So amoxicillin 875 milligrams PO by mouth twice a day for about 5 to 7 days, okay?
Okay.
Just remember to take the full course of antibiotics. Even if you start to feel better, still finish out that whole course, okay? For your wheezing that I've noticed, I would like to get you like an albuterol inhaler. It's just kind of like, it's a bronchodilator, which helps to expand your the bronchus part of your lungs, which is like that narrowing with wheezing. So that's what that's for.
Okay.
It should help with that. Just 2 puffs like every 4 to 6 hours, like as needed. Of course, it's for shortness of breath, cough, wheezing, and it just provides like a short-term relief, okay? Of course, if the symptoms were to be worse than that, you could call the office or, even call, the ER or like the ambulance 911 to see if they could help with it better.
Okay.
For the nasal congestion, I think just like a Flonase would be good. It's just like an over-the-counter. You can get that at your local drugstore.
Yeah, I've heard of that. Okay.
Just like 1 to 2 sprays
Okay.
in each nostril, kind of help with some of that drainage and some of that congestion that you've been having.
All right.
Helps to reduce inflammation, congestion, and the facial pressure that you've been having with your
good.
sinuses.
Okay.
All right. And then you can also do saline rinses if you feel that the Flonase isn't helping. You can do those in conjunction with each other. I did see you mentioned that you were taking Mucinex. I would just continue that.
Okay.
I would continue with that.
Okay.
And that should help with everything.
All right, that sounds good. What about taking like a nasal decongestant? I have Afrin at home. Would that be beneficial?
Okay, so if I were you, I would just stick with the Flonase for now. The Afrin can provoke mucosal inflammation, and I think it could make your symptoms worse and make it tougher for you to breathe.
Oh, okay.
So I would.
Well, that sounds good. I'll just go ahead and get the Flonase.
Okay, yeah, I think we should stick with that then.
Okay.
Of course, with like the congestion, the drainage, of course, increasing your fluid intake would be good. That helps with thin secretions. The
Okay.
Mucinex as an expectorant is going to help to get that out.
Gotcha.
And I don't feel at this time any lab work is necessary with what's going on. Since your symptoms aren't too severe, they can be managed at home. Of course, if your symptoms were to get worse, we could test for like influenza, RSV, or COVID. So if you have any other symptoms related to that, you of course would let me know.
Right. Okay.
Although I don't really feel like you have any of these right now.
Yeah.
So you do have seasonal allergies, which, might not be as worse now during the wintertime. But of course, if your symptoms were to get worse or you had any complications, we could always do like an IgE allergy panel just to get a definite type of what seasonal allergies you're allergic to. Not anything we need to do right now, but there's just something in the future if you want to,
Keep it in mind.
consider it. I don't feel that any imaging would be warranted with your symptoms. Of course, if you've had any complications with worsening shortness of breath, any chest pain, or failure to improve after the course of antibiotics, you might need to return back, and then we might have to do some more aggressive diagnostic treatments. Okay.
I understand. Yeah.
So I would like to see you again in about 7 to 10 days.
Okay.
Of course, reach out if you have a fever, if you have increased shortness of breath, just difficulty breathing. If your oxygen is like less than 94% or like less than 92, with that pulse oximeter you said that you had, just check that. If it's less than that, let me know.
Okay.
And then if you have any severe headaches, vision changes, or any like facial swelling,
Okay.
that could be indicative of a further problem I would need to assess. Okay.
Okay.
So if your wheezing persists after the infection is cleared, you might need to be evaluated for new onset of asthma. Of course, with that family history, you could, of course, have this, but that's something we can focus on later on. Your symptoms should begin to improve in 48 to 72 hours after starting the antibiotics. And just maintain hydration. You can use the humidifier at night and do the nasal saline rinses. And if you can, just avoid like smoking exposure or any strenuous activity until you feel better. Okay. What I'm going to do is when we're done here, I'll just have the nurse instruct you on how to use that albuterol inhaler, so you know how to use it correctly. Do you have any questions for me?
No, I don't think so. Thank you so much for your help, though.
Yeah.
I mean, I appreciate everything you've said, and that's been helpful. So hopefully we'll start feeling better. Thank you so much.
All right. Well, I hope so too. And of course, if you have any questions, just reach out on my chart, send me a message. I'll get back to you when I can. Okay.
All right. Sounds good.
All
Thank
right.
you.
I hope you feel better.
Thanks.